When a parent learns their child has autism, the options for treatment can be overwhelming. Some parents and doctors are sounding the alarm over a controversial practice known as chelation therapy. The regulations in Canada around this far from clear. It certainly raised questions for our Nicole Ireland, who's been looking into this and here with me in studio. I've not heard of this, so tell me a little bit about chelation therapy and how you came to hear about this.
Well, I'll tell you, so we came to hear about it because a parent who has a child with autism, her name is Anne Borden-King. Her son Baxter diagnosed with autism, and when that happened, she started to get involved with other parents and formed a support group. And she started to learn that a lot of parents were really pursuing a lot of, because we don't know exactly what causes autism, parents hear about all kinds of different treatments and all kinds of different ideas, and they were doing a lot of things that were unproven. And the thing that bothered her the most was chelation therapy. Now, chelation therapy is actually, it's a legitimate medical treatment, but it's used to remove heavy metals from the body. So what happens is it's usually done sometimes in pill form, usually with an IV. They go in, they have chelating agents, which means that they bind to, say, mercury or iron or lead, and then it's excreted from the body, usually from the urine. So it would be used properly for things like industrial accidents or if somebody had lead poisoning. But there was this thinking over the last several years. You may have heard, for instance, the controversy around vaccines. Right. People thought that perhaps mercury in vaccines was causing autism. So the same thinking, similar, people thought that perhaps if you removed metals from children with autism, that would help. But that theory has largely been disproven. So Anne Borden-King, this parent, wanted to kind of look into what the regulations were around this, and here's what she found.
It's this Wild West, that someone put it, where there is no law that says that you can't do these things, such as giving, that I know of, such as giving a child chelation.
The Wild West pretty much characterizes the lack of regulation around this. So what did she then do? So
she then went to Ontario's College of Physicians and Surgeons, the regulating body for physicians, because she learned of a particular doctor north of Toronto in Markham who was in fact offering chelation therapy for kids with autism. So she filed a complaint. The college came back to her and said that they weren't going to pursue any sanctions, that they actually found that the doctor had not violated what they call their complementary and alternative medicine policy. And we're not sure if one of the factors here was the fact that she hadn't herself met the doctor or the patients, that she was a third party. The college did mention that in their response to her. But the college, because they didn't actually lay any sanctions, won't discuss with CBC or anybody the details of this. But what's interesting about this complementary and alternative medicine policy that the college has is it specifically says that you can only use treatments that are scientifically and evidence-based.
Okay, and in this case, does that science exist?
Well, no. All the autism experts that we talk to say, in fact, it doesn't. And in fact, they say that it can be harmful. We actually spoke to a doctor here in Toronto at Hull and Bloorview Children's Hospital. She's a pediatric neurologist. Her name is Dr. Evdokia Adagnostou. And here's what she told us about what some of the risks are.
Chelation is a treatment for which we have no evidence of benefit and we have evidence of harm. Anything from just causing heart arrhythmia, so irregular heart rhythm, to kidney damage, to damage to the heart muscle, all the way to death.
So here's the thing. So not only is there those risks that are involved, we also know, for instance, from a regulatory standpoint, Health Canada does not approve chelation therapy for kids and for autism, but they say that it's up to the individual colleges to decide. And one other thing that doctors are worried about is the financial investment. These treatments aren't free. So doctors worry that if parents are investing their money into this kind of thing and getting hope from that, often false hope they say, they may not be investing in some of the things that work, like behavioral therapy, speech therapy, those kinds of more proven treatments.
Fascinating story in a subject area that parents are very, very captivated by. Online, CBCNews.ca if you want to read more about this. Nicole, thank you for coming in this morning.
Thank you.